to place someone in a crossroads moment, in the agonizing decision when they don't want to be vaccinated, that they are required to be vaccinated to enjoy their family life, to see a relative who is seriously ill, we think that is bordering in on being inhumane.
But in fairness, the GSD did question those measures in place at ERS at the height of the pandemic. You did talk about trying to find a solution. What would you propose?
Well, but I think there are solutions. Look, what is the most important thing? The most important thing, surely, presumably, is to have a negative swab, a negative test, when you go to visit someone in ERS and someone who is a patient in hospital. Now, someone who is vaccinated, there is still a thin possibility of that someone being a carrier for COVID. That's the reason for the COVID test. You can also have other measures. You can place people who are being visited by unvaccinated individuals in a different location. You can require those people who are visiting to wear PPE. But look, let's look at what is going to happen on the ground and look at the very contrasting situations. If you're an unvaccinated individual who has a traffic accident and you find yourself in hospital, you can be visited by someone who's vaccinated. If you're a vaccinated person who's had a traffic accident, you can't be visited by someone who's unvaccinated. It creates different classes of rights, even though you have the same interaction between vaccinated and unvaccinated individuals, and it's something that the public health authorities need to look at.
You also mentioned the fact that there are unvaccinated members of staff at ERS and perhaps also the GHA, the wider hospital as well. How do you feel about that?
Well, I think it just throws up the contradictions in the policy. We know now, because I've asked questions in the House, that 148 ERS staff members were COVID positive after the 1st of December. And there were, as you know, there was a massive outbreak of COVID in ERS. And yet, even though there was a duty of care, we also know that members of staff were not being swabbed on a daily basis. The daily swabbing of ERS staff members only started on the 28th or 29th of December. So that was on the cusp of the outbreak. So the reality is that when we talk about duty of care, that also is about the precautions that you take. So we weren't requiring vaccinations before. It's right that we have a vaccination program, and we are supporters of the vaccination program. But what we say is, let's not leave behind a section of Gibraltar's population. That still leaves a good 5,000-6,000 people, maybe more, who have been unvaccinated either through choice or because they've not yet come to be vaccinated. So let's not create different classes of individuals. We understand that going forward, there will perhaps be facilitations for example, international travel if you've been vaccinated or not. But no one is saying that if you haven't been vaccinated, you can't travel on a plane. So why are we saying that if you haven't been vaccinated, you can't visit your sick father or your sick mother or your sick daughter in hospital?